Hi, my name's Imran and I'm an eye doctor. So you're probably watching this because either you or someone you know has just been diagnosed with age-related macular degeneration, otherwise known as AMD. Well, stay tuned and we'll find out more about it in the next 2 minutes. AMD affects more than 600,000 people in the UK and is the leading cause of vision loss. The condition is most common in people over the age of 50 and it's estimated 1 in 10 people over 65 have some degree of AMD. Now let's imagine the eye to be like a camera. You have the lens at the front and the photographic film at the back. The photographic film at the back is the equivalent of the retina in the eye. Now the macula is a small central part of the retina that you use to see things clearly. If you imagine the retina to be the size of a postage stamp, the macula is a tiny pinprick in the middle. It is the most used area of the retina as the part you are now using to watch this video. If you have AMD, you lose the ability to see fine details both close up and at a distance. And this affects only your central vision. Your side or peripheral vision usually remains normal. Now this can make it difficult for people with AMD to recognize faces or read words on a page. And there are two main types, dry AMD and wet. Dry AMD develops when the cells of the macula become damaged by a buildup of deposits called drusen. This causes the macula to wear out over time, in the same way your knees and elbows can. It is the most common and least serious type of AMD, accounting for around 9 out of 10 cases. The vision loss is gradual, occurring over many years. However, an estimated 1 in 10 people with dry AMD go on to develop the wet form. Wet AMD, sometimes called neovascular AMD, develops when abnormal blood vessels form underneath the macula and damage its cells. It's a bit like when a road wears out over time and weeds start growing through the cracks. Blood vessels start growing through the worn out macula. Now, wet AMD is more serious than the dry form. Now, unfortunately, there's currently no cure for either type of AMD. With the dry form, treatment aims to help a person make the most of the remaining vision. For example, magnifying lenses can be used to make reading easier. Now, there's some evidence to suggest a diet rich in leafy green vegetables may slow the progression of dry AMD. And if you smoke, you definitely need to stop. With wet AMD, this can be treated with antivascular endothelial growth factors, otherwise known as anti-VEGFs. This aims to stop your vision getting worse by preventing further blood vessels developing. The early diagnosis and treatment of wet AMD is essential for reducing the risk of severe vision loss. So there you go, a quick guide to age-related macular degeneration. If you have any more questions, feel free to stick them in the comments below and I'll try and get back to you. Till next time.